Hello, everybody. This is Sharonda, and this is my podcast, Health Matters. And in this podcast, I go over chronic care conditions, ailments, and symptoms, signs and symptoms of your common everyday diseases and conditions, and go over some of the physiological effects. So today, I'm going to speak on lymphedemia. I am on Mayo Clinic's website. Okay, so what is lymphedemia? Well, it refers to the tissue swelling caused by accumulation of protein-rich fluid that usually drains through the body's lymphatic system. It most commonly affects the arms or legs, but also occur in the chest wall, abdomen, neck, and genitals. Lymph nodes are an important part of your lymphatic system. Lymphedemia can be caused by cancer treatments that remove or damage your lymph nodes. Any type of problems that blocks the drainage of lymph fluid can cause lymphedemia. Severe cases of lymphedemia can affect the ability to move the affected limb, increase the risk of skin infections and sepsis, and can lead to skin changes and breakdown. Treatment may include compression bandages, massage, compression stockings, sequential pneumatic pumping, care for skin care, and rarely surgery to remove swollen tissue or to create new drainage routes. So what are the symptoms? The symptoms of lymphedema, swelling of part or all of the arm or leg, including fingers or toes, a feeling of heaviness or tightness, restricted range of motion, recurring infections, hardening and thickening of the skin. So it says signs and symptoms can range from mild to severe. Lymphedemia caused by cancer treatment may not occur until months or years after treatment. When to see the doctor? So you want to make an appointment to your doctor if you notice persistent swelling in your arm or leg. If you've already been diagnosed with lymphedema, see your doctor if there is a sudden drastic increase in the size of the involved limb. And so what are the causes? Well, the lymphatic system is a network of vessels that carries protein-rich lymph fluid through the body. It's part of your immune system. Lymph nodes act as filters and contain cells that fight infection and cancer. The lymph fluid is pushed through the lymph vessels by muscle contractions as you move through the task of your day and small pumps in the wall of the lymph vessels. Lymphedemia occurs when the lymph vessels are not able to adequately drain lymph fluid, usually from an arm or leg. The most common causes of lymphedemia includes cancer. So if cancer cells block lymph vessels, lymphedemia may result. For instance, a tumor growing near a lymph node or a lymph vessel could enlarge enough to block the flow of the lymph fluid. You also have radiation treatment of cancer. Radiation can cause scarring and inflammation of lymph nodes or lymph vessels. Surgery. In cancer surgery, lymph nodes are often removed to see if the disease has spread. However, this doesn't always result in lymphedemia. Parasites. In developing countries in the tropics, the most common cause of lymphedemia is infection with thread-like worms that clog the lymph nodes. Less commonly, lymphedemia results from inherited conditions in which the lymphatic system doesn't develop properly. So what are the risk factors? Older age, excess weight or obesity, rheumatoid or psoriatic arthritis. Some of the common complications, you may have skin infections such as cellulitis. The trapped fluid provides fertile ground for germs, and the smallest injury to the arm or leg can be an entry point for infection. Affected skin appears swollen and red and is typically painful and warm to the touch. Your doctor may prescribe antibiotics to keep on hand so that you can start taking them immediately. Sepsis. Untreated cellulitis can spread into the bloodstream and trigger sepsis, a potentially life-threatening condition that occurs when the body's response to an infection damages its own tissue. Sepsis requires emergency medical treatment. Leakage through the skin. With severe swelling, the lymph fluid can drain through small breaks in the skin or cause blistering. Skin changes. In some people with very severe lymphedema, the skin of the affected limb can thicken and harden so it will resemble the skin of an elephant. Cancer. A rare form of soft tissue cancer can result from the most severe cases of untreated lymphedemia. So we're going to go over the diagnosis and treatments. So if you're at risk of lymphedemia, if you have had cancer surgery involving your lymph nodes, the doctor may diagnose lymphedemia based on your signs and symptoms. So they may run some tests, and the test will comprise of an MRI scan, which uses a magnetic field and radio waves. An MRI produces 3D high-resolution images of the involved tissue. The doctor may order a CT scan. This is an X-ray technique, produces detailed cross-sectional images of the body structure. CT scans can reveal blockages in the lymphatic system. Ultrasound. This test uses sound waves to produce images of internal structures. It can help find obstructions within the lymphatic system and vascular system. We have a lymphoscintigraphy. During this test, the person is injected with a radioactive dye and then scanned by a machine. The resulting images show the dye moving through the lymph vessels, highlighting blockages. So treatments. Well, there's no cure for lymphedema, but treatments focuses on reducing the swelling and preventing complications. So there are some medications that you may be able to take. It says lymphedema greatly increases the risk of skin infections. So your doctor may prescribe antibiotics. There is other things that can be done to help manage your lymphedema. Exercise, gentle contraction of the muscles in the arm or leg can help move the excess fluids out of the swollen limb. Manual lymph drainage. Therapists trained in a massage-like technique use very light pressure to move the trapped fluid in the swollen leg towards an area with working lymph vessels. People should avoid manual lymph drainage if they have a skin infection, blood clots, or active cancer in the affected limb. Compression bandages. Using low-stretch bandages to wrap the entire limb encourages lymph fluid to flow back towards the trunk of the body. Compression garments. Close-fitted elastic sleeves or stockings can compress the arm or leg to encourage lymph fluid drainage. These garments often require a prescription to ensure that the proper amount of compression is used. You may need to be measured by a professional to ensure proper fit. Subsequent pneumatic compression. A sleeve worn over the affected arm or leg connects to a pump that intermittently inflates the sleeve, putting pressure on the limb and moving the lymph fluid away from the fingers or toes. So there are surgical and other procedures. The doctor may elect lymph node transplant. Lymph nodes are taken from a different area of the body and then attached to the network of lymph vessels in the affected limb. Many people with early stage lymphedema see good results from this surgery and can decrease the amount of compression needed. New drainage paths. Another option for early stage lymphedema. This procedure creates new connections between the lymph network and blood vessels. The excess lymph fluid is then removed from the lymph via blood vessels. Removal of fibrous tissue. In severe lymphedemia, the soft tissues in the lymph become fibrous and harden. Removing some of this hardened tissue, often through liposuction, can improve the lymph's function. In very severe cases, hardened tissue and skin may be removed with a scalpel. Okay, so it has here, there are some lifestyle and home remedies to reduce the risk of complications from lymphedemia. It says avoid injuring the affected limb. Cuts, scrapes, and burns can invite infections. Protect yourself from sharp objects, such as electric razor. Wear gloves when you're gardening or cooking. And if you sew, to use a thimble. Coping and support. So you want to find out all you can about lymphedemia. So you want to communicate with your doctor and or physical therapist. Take care of the affected limb by cleansing the skin every day. Looking over every inch of the affected limb for signs of trouble, such as cracks and cuts. Apply lotion to prevent dry skin. Take care of your whole body. Eat a diet rich in fruits and vegetables. Exercise daily if you can. Reduce stress. Try to get enough sleep. Take care of your body. Gives you more energy and encourage healing. Get support for others with lymphedemia. So you may want to reach out to a support group that may have community-based meetings that you can, speak with others in regards to lymphedemia, and you can educate each other. Okay. So once you prepare for your appointment with the doctor, you want to list the following: your symptoms, including any that you've seen that may seem unrelated to the reason for which you scheduled an appointment. So you want to write this down in a journal or a notebook. Keep personal information, including major illnesses or trauma, cancer treatments, or recent life changes, as well medications such as vitamins and supplements you take. And then you want to write down your questions. If you have any questions in regards to what you want to ask the doctor, it would be wise to have that written down as well. So some of the questions that you may want to ask the doctor, as it has listed here: what is the likeliest cause of this swelling? Like, what is the cause of the swelling? Could there be another cause? What tests do I need? Do these tests require special preparation? Is the swelling temporary or long-lasting? What's the treatment for lymphedemia? Are there alternatives to the approach you're suggesting? Are there medications to ease the swelling? I have other health conditions. How can I manage them together? Do I need to restrict my diet or activities? Do you have any brochures or other printed material that I can take? And what websites do you recommend? Okay. So it says what to expect from the doctor. So your doctor is likely to ask you a number of questions such as, well, when did the swelling begin? So you want to have an account as to when it began. Did anything precede the swelling, such as a surgery, trauma, radiation therapy, or new medications? Do you have any other signs or symptoms? Has the swelling been continuously occurring, or is it something that occasionally occur? Does anything seem to make the swelling better? Does anything to worsen the symptoms? What have you tried to treat the edema, and how did it work? Okay, so what you can do, as it has mentioned here, in the meantime, is keep the swollen limb elevated as much as possible and protect your skin from injury. The swelling for lymphedemia might dull pain from an injury or burn, so don't use heating pads on the affected area, and you want to moisturize the skin daily. Okay, so that is a number of doctors that you may want to go to once you go to your primary care doctor, if there's a need for a vascular surgeon or a specialist to, monitor you and things of that nature, that may be, something that you would need to talk to your primary care doctor about, okay? So I'm going to conclude this episode of Health Matters, speaking on lymphedema, and thank you for listening in. Have a good day.